In his budget speech, the Prime Minister reminded us of how far we have come as a nation since our independence 60 years ago. We have moved from third world to first world, and we have seen our economy improve from a state of bare survival to one of resilience. Most of us have our basic needs met in housing, education, healthcare, and employment. Despite the continuing global and external uncertainties, we are well positioned to face these challenges together. Our multiracial and multi-religious society remains cohesive and harmonious, and we continue to enjoy political stability, peace, and security despite external tensions. We must treasure all this and preserve what has taken decades to build. I described last year's budget under three broad themes. Firstly, being faithful in stewarding our limited resources from our fledgling state and seeing this steadily grow to our current levels. In Budget 2025, we continue fiscal prudence and good stewardship. Secondly, continuing to introduce measures and initiatives that were directly targeted at taking care of the welfare of our people, which also includes our foreign workers in our midst. In Budget 2025, we enhance help for many groups. Thirdly, being a blessing to one another, sharing as we ourselves have been blessed, and how we have also shared beyond our borders. In Budget 2025, we enhance the spirit of giving. Budget 2025 continues the path forward, deepening and strengthening many areas covered from last year's budget. It is commendable that we managed to achieve much through last year's budget and still end the fiscal year 2024 with an estimated surplus of 6.4 billion. Similarly, Budget 2025, with extensive immediate support initiatives and significant longer-term investment for our future, is forecast to end with another surplus of 6.8 billion. This year's forecast surplus is extremely helpful to navigate local and global uncertainties should the need arise. Madam Speaker, we continue to look at measures to support all Singaporeans and work toward the commitment that no one is left behind. May I declare my interest as a board member of two social service agencies in mental health services, suicide prevention, and also on the working group of Project Hayat. Budget 2025 will enable many to continue to thrive and at the same time move others forward to not just survive, but also to thrive. Nevertheless, we need to recognize there remain vulnerable groups that our current and future policies need to address. Let me start with persons with disabilities and special needs, including autism. This budget provides for avenues of support for such persons post 18 years of age, and more specifically in the area of employment. However, we must also find avenues for those who may not be in a position to work. These individuals also deserve to have access to an acceptable level of quality of life. It would not be appropriate to see them as a burden to society just because they may not be considered economically productive. Persons with mental illness are also a broad, vulnerable group. Much has been debated in this House on mental health and well-being, and the many interventions we have and continue to introduce. In previous speeches, I have put to this House specific consideration for better employment support for persons in recovery from mental illness. Will the government reconsider the position for support for persons in recovery both by way of some form of disability allowance or support during treatment and rehabilitation when they are unable to work and be gainfully employed, particularly if their financial situation warrants such support. In addition, would the government reconsider support for employers of persons in recovery in ways similar to the Enabling Employment Credit and SG-Enable grants as it relates to persons diagnosed with a mental health condition? And here I would just like to add my appreciation to many employers who are already providing this support by employing persons in recovery. In some cases, the mental illness may be so debilitating that these individuals require a very long recovery time. Can we better support them so no one is left behind? This budget continues the advocacy for lifelong learning. Should we take a closer look at the options and consider where we may need to tailor these for vulnerable groups so that they too can benefit? Persons with intellectual disability or autism may need tailored courses in their adult life. Some may need to or desire to reskill. I hope we will provide these options, especially where the levels of learning may need to be moderated. In other words, Madam Speaker, may I suggest we provide or expand appropriate skills and other courses for these special groups. I'm pleased to see the inclusion in the support of caregivers. I hope we will comb through all caregivers progressively and comprehensively, and over time, give them the necessary support. Madam Speaker, I would now like to address the issue of suicide prevention and support for individuals and families affected by suicide. Suicide is tragic and a most painful encounter, whether by family, friends, or communities. In 2023, based on statistics from the Samaritans of Singapore, we lost 322 lives to suicide. It is the leading cause of death for those aged between 10 and 29 years of age. There's also the increased risk of suicide amongst the elderly. Suicide cuts across all age groups and all strata of society. One suicide affects many, many others, including family, friends, and communities. There are many who attempt suicide and need support. Families and friends who care for individuals with suicidal ideation also need support and help. Project Hayat is a community-led effort guided by a work group comprising policymakers, suicide experts, researchers, community workers, and helping professionals, religious leaders, corporate leaders, representatives from the media, and people whose lives have been impacted by suicide. Project Hayat presented a white paper to the government in late September 2024, covering 23 recommendations for a national suicide prevention strategy in Singapore under the Save Lives framework, SAVE-LIVES, using the acronym, each highlighting specific course of action. The research conducted for the white paper included direct interviews with key stakeholders from countries with national suicide prevention strategies, such as Indonesia and South Korea, focus group discussions with people in Singapore who have been directly and indirectly affected by suicide, including parents, youth, educators, first responders, healthcare and emergency services personnel, religious leaders, media representatives, and the first phase of public consultation with more than 500 respondents sharing their views on suicide and suicide prevention. I understand the government has provided an initial response to the white paper through the Minister for Health. The paper identified several vulnerable groups. I will expand on 3 of these groups. First are the youth and adolescents as a vulnerable group. According to data from the Samaritans of Singapore, As mentioned earlier, suicide remains the leading cause of death for nearly 30% of young people aged between 10 and 29 over the last 5 consecutive years. This is up until 2023. Based on a study of 221 patients aged between 10 and 19, which were presented to hospitals' emergency departments for suicidal or self-harm attempts in 2021, not all adolescents at risk of self-harm and suicidal behaviors have serious mental health disorders, but instead have psychosocial problems and emotional regulation difficulties. Of these, only 48.4% of the patients studied had ongoing psychiatric or psychological support. More than half of the patients had ambivalent intent, that is, confused about whether they truly wanted to end their own lives, which highlights impulsivity and the lack of emotional regulation. The study found a predominance of female patients, in this case 85.5% over male patients. Hence, focusing on risk factors for females, such as eating disorders and past history of self-harm, can inform risk management strategies in schools and in communities. Secondly, migrant workers as a vulnerable group. In a 2021 study of non-resident suicides which occurred in Singapore between 2011 and 2014, it was found that most resident suicide cases did not have a known physical or mental health issue prior to suicide attempts or suicide notes. Based on the analysis of available suicide notes, relationship and health problems emerged as the top 2 suspected triggers for suicide. The researchers therefore hypothesized that the unique situation of working abroad may increase non-residents' vulnerability in general, while adverse life events such as relationship issues and health issues may be too overwhelming to bear, especially when support services are not readily available and accessible. Third group, the vulnerable group identified in this white paper, neurodiverse population. I'll just share an anecdote from a parent who lost their child who had autism spectrum disorder to suicide and recounted this in the focus group discussions. I don't think he can understand why he cannot seem to get along as well with other children as maybe his classmates can. So I think there's also the feeling of rejection. I always thought that if he had managed to live to COVID, perhaps he would still be alive because we are all just in our safe little space. He doesn't have to go out and socialize. I always wish that he had that 2 extra years, but it just didn't happen. 3 other vulnerable groups identified in the white paper include the elderly, caregivers, and LGBTQ community. Recommendations for vulnerable groups in the white paper include strengthening governance and policy, involving communities of people at risk of suicide and those with lived experience of suicide in all aspects of policy making and implementation of suicide prevention policies. A key feature of suicide prevention efforts across the world is to ensure that people who have been affected by suicide are involved in all aspects of suicide prevention, including policy making, implementation, research, and advocacy, involving individuals who belong to communities at greater risk of suicide, survivors of suicide, and those who have lived experiences of suicide is essential in bridging gaps in suicide prevention. We need to value data and research. Investing in research on the upstream determinants of suicide amongst the vulnerable groups, and to conduct further research to determine additional priority groups in Singapore. There's a strong link between upstream factors and social determinants that heighten suicide risk among vulnerable groups and those who are experiencing loneliness or hopelessness in their lives. More research is required on priority populations that are at greater risk of mental health challenges, self-injury or suicide, and to develop evidence-based interventions that are tailored for these respective communities. Another recommendation is to involve families and communities, strengthening family support initiatives to manage mental health and suicide prevention, and strengthening collaboration with religious and community leaders. Family-focused programs should be developed to equip families with knowledge and skills to recognize early signs of distress, facilitate open and supportive communication, and offer practical strategies to assist loved ones facing mental health struggles. As trusted figures within communities, religious and community leaders hold significant influence and often seen as sources of support and guidance, making them well-positioned to promote mental health awareness and reduce the stigma surrounding suicide. Leaders can foster an environment of compassion, understanding, and acceptance to reduce stigma, as well as play a key role in identifying individuals at risk and providing timely support. Support schools and educators, and here more specifically to adolescents. Establish suicide prevention protocols in schools for suicide prevention, crisis response, and post-prevention support. In focus group discussions conducted under Project Hyatt, participants have expressed concern that school staff, counselors, and teachers may be insufficiently equipped to provide psychological support or conduct suicide risk assessments for students in need. It was also found that many educators may lack the necessary training to identify warning signs, manage crises, or intervene effectively in suicide-related situations, leaving a critical gap in the support network for vulnerable students. By developing and implementing clear protocols and comprehensive training programs, schools can ensure that educators, school counselors, and students are better prepared to respond to suicide risks. And this would involve equipping school staff with the tools to recognize early signs of distress, intervene appropriately, and provide ongoing support to students facing mental health challenges. Madam Speaker, as this is a budget for all Singaporeans, we must continue to find ways to adequately support the many vulnerable groups where these are not yet in place. I have covered those with mental health conditions, persons with disability and special needs, caregivers, and propose for more to be done to prevent suicide. We will need to work together, government and society, to ensure no one is left behind. I would like to conclude on the spirit of giving and the increased support in the budget to encourage a generous society. Many large charities today started small. Just like our nation, this will have taken time, most likely decades of tireless efforts of dedicated individuals and their supporters, including government and private donors.
Mr. Chua, you have 1.5 minutes, so I'd ask you to round up.
Our charities, both large and small, continue to form part of our social support network, providing daily care to many beneficiaries. Many smaller charities will find funding a continuing challenge. Smaller charities will be essential to address gaps as we work towards the objective of caring for everyone who needs help. I hope the three groups mentioned by the Prime Minister, Community Chest Collective, the Collective for a Stronger Society, and the President's Challenge, will find ways to channel this increased resources to some of the smaller charities who will be essential in ensuring no one is left behind. We are an increasingly caring and generous society. The multiplier effect when everyone who can gives will be extraordinary. I hope future budgets will continue to nurture the spirit of giving and see greater collaboration between public and private initiatives that will ensure that no one is left behind.